My name is Jason Schuster. I'm a doctor of physical therapy. Before that, I was a fly fishing guide in Patagonia, Chile for a decade. Now I own a continuing education company teaching other doctors how to do a couple things, including dry needling. This is a part of my online dry needling class, Online Dry Needling 1, Dry Needling in the Autonomic Nervous System. This is about how to specifically target the autonomic nervous system with dry needling. This is a great course, you guys. You can check it out on our website, intricateartseminars.com. Check out the first part of this video series on my YouTube channel. Hope you guys enjoy it. So here's another picture. We talked about this already, you guys. So let's just review it again just to make sure that people understand what I'm talking about here. So the left picture, the little dot in the left picture in picture A, let's just assume that's a 0.2 millimeter needle put in the body. That is the only tissue treatment area in this picture, is that little black dot. In the right picture, in picture B, you get the whole square is now getting rotated, or all those collagen fibers are getting twisted throughout that whole square. So you're going from treating 0.2 millimeters of tissue to 50 square millimeters of tissue, both with just one needle. So with one poke of a needle, you guys, you can either choose to treat 0.2 millimeters of tissue, or you can choose to treat 50 square millimeters of tissue, just with the difference of rotating the needle or not. So I don't know about you guys, but treating 50 square millimeters of tissue per needle seems a whole hell of a lot better than treating 0.2 millimeters of tissue. And one of the other things, you guys, and we'll get to this in a second, but the more times you poke people with a sharp object, the more that initially elevates their sympathetic nervous system, which will cause people to go vasovagal on you much more frequently. It'll make the entire treatment more uncomfortable, right? So this is very, very important stuff. I like to twist all my needles. Basically, the underlying way to think about it, I think, you guys, is by not pistoning and by using more needles, by rotating the needles and by leaving the needles in the body longer, you're aggravating the sympathetic nervous system far less. You're inducing far more parasympathetic dominance compared to baseline as an overall result. It hurts the patient less. The treatment's more effective. You treat more tissue with less aggravation. Everything about it is better. So needle retention, you guys, we talked about this. I've really changed my idea on the needle retention. So I typically leave my needles in place for about 60 minutes. Sometimes I try to leave them longer. If people fall asleep with the needles in, I'll just leave them. I'll let them sleep on my table for, sometimes like 2 hours when I just do work. That seems to work really good too. But leaving the needles in longer is without question way more effective than leaving the needles in less time. There's just some point of no improving return. I've never seen this studied, you guys, but this would be relatively easy to study. So let's talk about what happens to the autonomic nervous system while you're getting poked with needles, and what happens to the autonomic nervous system after you've been done getting poked with needles. So we're getting stabbed with sharp pieces of metal, you guys. Getting poked with sharp objects elevates the sympathetic nervous system. Number one, you can never just affect one side of the autonomic nervous system, right? So keep that in mind. So needling initially does elevate sympathetics. So what happens, you guys, is per literature, for the first 15 to 20 minutes or so, while you're putting the needles in, and after you're done poking needles into people, for about 15 to 20 minutes, the sympathetics are going to be spiked compared to baseline. So you're getting stabbed with sharp stuff. Your sympathetics are going to spike. If you're aggravating people's sympathetic autonomic nervous system too much, too fast for their individual threshold, that's when they start to go vasovagal. So vasovagal response, you guys, is an overreaction of the body to the sympathetics going up too fast. The sympathetics start to ramp up. The baroreceptors, the pressure receptors in your carotids and elsewhere start to sense the increased blood pressure, and they fire off, and then your body overreacts, the brain overreacts, and it's like, whoa, no way. It cranks the parasympathetics all the way up, which more or less turns off the sympathetics for a second, plummets your blood pressure goes down, and in the most severe instances, you pass out. People are much more likely to pass out if you're doing the pistoning technique on them, because you're aggravating their sympathetic nervous system way faster, way more than you do with just inserting the needle once and rotating it. you're not treating nearly as much tissue by doing the pistoning, and you're aggravating people way more. So by doing the pistoning technique, overall, you're treating less tissue, you're aggravating the sympathetics way more than you need to, and the result is far less parasympathetic dominance or far less autonomic nervous system homeostasis than you would get if you did the single insertion technique, rotated the needles, and left them. So this is our autonomic nervous system centered approach to needling, you guys. That's kind of what I like to call it. So when I treat anybody with needles, my underlying goal is how can I regulate this person's autonomic nervous system as much as I can. It's never focused on the specific impairment. That's not nearly as important, you guys. Generalized regulation of the autonomic nervous system is far more important. And if you think about targeting the autonomic nervous system itself, you're always going to be led to the area of primary complaint, because that just makes sense. It's like if somebody comes in and they say, my shoulder's killing me, you obviously need to treat the shoulder to regulate their autonomic nervous system. But I think for most people, it helps most people stay away from that tunnel vision where it's like somebody comes in with a shoulder problem. The way that 90% of physical therapists treat that person is they just focus on the shoulder, like maybe the elbow, maybe the neck, but primarily just the shoulder. And that's again, that's not like a technically wrong way to treat people. It's just the least effective way possible to fix somebody for any condition is to just treat the part of their body that hurts. That will work for some people. It's just not nearly as effective. So if you use our autonomic nervous system centered approach and you target the nervous system itself, that's always going to lead you to the area of primary complaint, but it also helps you continue to focus on the entire rest of the body and treat the whole system as a singular unit. So depending on the placement of the needles, you guys, that is going to depend on how much nervous system aggravation the patient gets to start with. So if you start poking needles into the most pathologic tissue on their body, that is going to elevate their sympathetics initially more than anything else. This has been pretty well objectively shown, you guys. The time is going to be off. This is just a huge average. But in general, this is what happens to the nervous system when you're getting needled. The sympathetic spike, they go down, and then the parasympathetics become dominant. You can easily see this in physical sensations from the patient too. Like they'll initially start to sweat, which is a sympathetic autonomic nervous system activity, or their hands will initially get cold, which is vasoconstricting from the sympathetics going up. And then the parasympathetics will become dominant and their hands will get warm and things will change. So you can see that actually happening in the tissues if you pay attention. And we have been able to test this very objectively. What I would love for these people to do, you guys, and this has never been done, is just take that one of the exact same studies that they've done that's shown that the sympathetic spike for about 15 or 20 minutes and then they go down below baseline and then the parasympathetics become dominant. All they would have to do is do that exact same study again over, but just do the very first needles that you put in the body would be vagus nerve needles, and then do that same experiment over again. And I 1000% guarantee you guys, the amplitude and the duration of that initial sympathetic spike would have to be dampened, right? So if the autonomic nervous system is like a seesaw, and poking needles into the body elevates the sympathetics first, and then the parasympathetics become dominant, if we target the most parasympathetic dominant structure in the human body with our very first needle, which would be the vagus nerve, the auricular branch of the vagus nerve in the ear, that's the most direct stimulation of the parasympathetics that we can get. So if we initially stimulate the parasympathetics, that has to initially depress the sympathetics. And then as we start poking around in tissues that are not as closely linked to the parasympathetic nervous system, that initial parasympathetic stimulus has to put a dampener or a governor on that initial sympathetic spike. So that initial parasympathetic stimulation limits the amplitude and the duration of that initial sympathetic spike, which gets people out of sympathetic hyperactivity faster, which makes people way more comfortable. It makes the needles less painful. And it does somehow, in some way, shape, or form, it makes the parasympathetic dominance last longer. So it shifts the nervous system farther towards homeostasis, you guys, and it makes it last much longer. The same overall effect happens if you just do the pistoning and you poke people with needles and you take them out. That nervous system shift from sympathetic hyperactivity to parasympathetic dominance still happens. It just happens after the needles are out of the body. It happens to a much lesser degree, and it just leads to it leads to less good outcomes or worse outcomes. Like, the outcomes are still good, they're just much less good than they would be otherwise. So again, you guys, bottom line, try to leave the needles in for longer rather than shorter. Use more needles rather than less, and target the parasympathetics with your very first needles, because that will make treatment more comfortable for people. It will allow them to tolerate more needles. It will allow you to treat more tissue pathology. It will allow you to shift the nervous system more towards parasympathetic dominance. It will allow you to induce more homeostasis, and it will allow you to improve the health of your patients and your own health more than you would be able to otherwise. Thanks for watching, you guys. To continue this video, make sure to keep an eye on my channel. There'll be many parts to this series. This is part of our online dry needling 1 course. We have 2 online dry needling courses. We have a live online dry needling course, and we have a bunch of in-person dry needling courses, all board certified and accredited. If you want a discount on our online dry needling courses, check out our school community. It's school.com/CEU, SKOOL.com/CEU. You can get a discount there on our online dry needling courses, on our online nutrition courses, and a whole bunch of other good stuff. I have weekly Zoom meetings there. We have a private community chat room. It's a really awesome community. Check it out. Thanks for watching, you guys. See you next week.